Naturally, lower high blood pressure, the turbo method that almost always works. Many people with high blood pressure desperately try to reduce their medication, and in this video I will introduce you to a real turbo method that I have had a lot of clinical experience with. See, what does an emergency situation look like? At the moment when one has very, very high blood pressure, one must of course call the emergency doctor or paramedics, who will then pull out a spray, and if that doesn't help, one must talk to their patient intravenously until the blood pressure is back to normal. Of course, this is not the solution, and it is also the emergency situation, and many people will undoubtedly have to take a lot of medications. Undoubtedly, medications are also the fastest and probably initially the best emergency route, even in practice, to get one's blood pressure back down. But long term, one naturally wonders why they developed such high blood pressure and how to get rid of it. For instance, during stressful periods in life, if someone has always taken just 1 or 2 medications at a stable dosage, their blood pressure might suddenly increase, and such individuals do not wish to start taking more medications and are looking for a solution. But before we get to this method, here are some facts about high blood pressure. About a quarter of the world's population has high blood pressure, and it is estimated that by 2025, this will rise to a third of the world's population. That's around 1.5 billion people with high blood pressure, and this issue is similarly severe and widespread in all countries around the world, including here in Germany, where we also have many people with high blood pressure, and it is simply the number one risk factor for cardiovascular diseases. Cardiovascular diseases are then responsible for the majority of deaths, and we have about 20 to 30 million citizens in Germany with high blood pressure. 3 out of 4 people aged between 70 and 80 have high blood pressure. Unfortunately, only 30% of those affected are aware of their condition, and that's essentially the dangerous part. Make sure you regularly check your blood pressure, either at the doctor's or simply at the pharmacy, because it can be dangerous. Then you could have a stroke and many other diseases. About 88% of those who are aware of it also seek treatment. And then there are always those who are stubborn and do nothing. And with such treatment, about 3/4 of all hypertension patients can have a really stable and effective therapy with good blood pressure. Now, of course, there are many scientific tips, and tip number 1, which is completely overlooked and forgotten in practice, is actually the most effective one, which is weight loss. And how does it work in practice? Well, a prescription is quickly slid across the table. That takes 10 seconds. Talking to someone about losing weight, even if it's just 1 or 3 kilos, I'm immediately looking at half an hour or an hour of explaining. And yes, my dear medical colleagues, we must admit that we prefer to write prescriptions rather than talk. And yes, dear health insurance companies, you're cutting people off from dietary counseling. Back when I started as a doctor, the whole thing with nutritional counseling was much better organized. Nowadays, no one gets that anymore. Yes, dear food industry, you too are doing everything to make people sicker and fatter as long as your growth numbers are right. Granini is currently experiencing a major backlash with their former fruit juice, now facing a total marketing disaster. Why? Quietly and secretly, Granini has just recently turned a real fruit juice with 100% fruit content into a lower quality nectar. That means they simply removed 50% of the juice and replaced it with sugar water. No more drinking pleasure. The consumer and press backlash couldn't be bigger. But really, we humans are to blame, because we always fall for these tricks of the food industry. We just need to look at some numbers. We're actually so foolish that we consume foods with a higher energy content than sugar, which is quite alarming. Because pure sugar has about 400 calories per 100 grams, and then you look at something like a fancy granola, a crunchy muesli, that suddenly jumps to 470 calories. And if we check out the world-famous Milka Alpine milk chocolate, that's at 539 calories per 100 grams. So, we're making our food even more calorie dense than pure sugar. You can verify all this on their website. We'll talk about the turbo method in a bit, but let's not forget one thing, we're just eating too much salt. And here we really owe a big thanks to the food industry, because even bread just contains way too much salt. And you already know the one who always goes overboard from my last blood pressure video. You've been a vegetarian since 1987 and have been cutting out salt since 1989. How can food taste good without salt? Yet it's undisputed that we consume too much salt, even though, in my opinion, the German Federal Minister of Health is completely off track by going salt-free. The risk of mental confusion from sodium deficiency due to completely eliminating salt would be too high for me personally. But let's not delve too deep into that. We know that by reducing sodium with a low sodium diet, one can typically save on 1 or 2 blood pressure medications, and the American Heart Association is very precise. It recommends 1.5 grams of sodium per day should be our intake. For comparison, 100 grams of sausage contains 0.7 grams of sodium, 100 grams of cheese contains 0.3 grams of sodium, and the daily requirement from bread already includes 0.5 grams of sodium, and we need to convert this sodium content. We have to multiply the sodium content by 2.5 to get the salt content, and there are many studies showing that the limit is actually around 2.3 grams of sodium or 5.8 grams of salt, so the American Professional Society here is quite strict. Therefore, we can relax a bit on this issue, but try to use as little salt as possible. And let's get back to the main topic, the so-called turbo method. I know this method very well. I actually spent 4 years as a fasting doctor at a clinic, and it's all about fasting. And we'll also look at some data on intermittent fasting, which is really very popular. But first, let's talk about fasting itself, because with fasting, most people, and I'll show you the data, can lower their blood pressure very, very quickly. And so quickly that as a fasting doctor, you have to reduce blood pressure medications by 30 or sometimes even 50% on the first day. Otherwise, you end up with a patient who gets so dizzy, has such low blood pressure that they could actually faint. You only make that mistake once. How does such a fasting process work? Typically, fasting lasts about 7 to 10 days. There are 1 or 2 introductory days where you already start to reduce your food intake, followed by what's called water fasting, where you really only have water. I recommend broth fasting or vegetable juice fasting or juice fasting. In these you get a small amount of food daily. The main point here is to provide fiber for the gut bacteria to give them something to munch on. This way, there are also no issues with bowel movements. This implies that even while fasting, bowel movements persist, and a hint of taste can significantly enhance motivation for the fasting duration. It is essential, particularly for individuals with high blood pressure, to seek professional fasting assistance, which may come from your primary care physician if a fasting expert is unavailable. I recommend that your initial fasting encounter take place in a sanatorium or hospital setting. Alternatively, a clinic can also be suitable. There are specialized fasting clinics that manage this process with expertise. Why? Because we really need a doctor nearby who can adjust the blood pressure medications, or we should also have nurses who are well versed in this. The second fasting period can then be done on an outpatient basis. It works with outpatient fasting groups too. If you live in a rural area and only have access to an outpatient fasting group, then the fasting leader should also be trained and collaborate with doctors and be able to inform them about various aspects. But how does such a fasting process unfold, and what ultimately do you need to do? There are some really, really good people in this field, and there are also fasting societies. You might want to check them out. Then we can scientifically prove the whole thing. Oh yes, let's look at a fasting study. What did they do? Here they conducted a short pre-fasting period averaging 1, 2, 3 days depending on the clinic and facility. During this time, food intake is usually somewhat reduced, limited to fruits, vegetables and so on. And then in this study they conducted phase 2, 3 days long. Following that, they undertook a medically supervised water fast lasting 10 to 11 days. Afterward, they initiated the refeeding phase averaging 6 to 7 days. This dietary reintroduction starts slowly, typically with a steamed potato or a steamed apple when breaking the fast. This is something the fasting participants particularly look forward to. And then you switch to a low-fat and low-sodium diet, usually for high blood pressure or a vegetarian or a vegan diet. In this case, a vegan diet was adopted. And what's special about it, in this study, 90% of participants achieved an average blood pressure improvement of 37 to 13 millimeters of mercury. So that's incredible. The first number dropped by almost 40 and everyone had a blood pressure. So over 90% had a blood pressure of less than 140 over 90, thus out of this death zone. So there were participants who had a blood pressure of 180 and they then lowered it below 140. The higher the blood pressure, the more dramatically we see the benefits of fasting. The average reduction was nearly 40 millimeters of mercury for the first number, and there are many studies like this, such as our next study. There they even observed a correlation with diabetes mellitus type 2, where they had diabetics undergo fasting. They conducted a 7-day fasting program followed by dietary counseling similar to the first study, and they limited the calories to 300 kilocalories per day and then followed up with this group 4 months later, and the average weight dropped by 3.5 kilos in this fasting group, and there was also a reduction in waist circumference and again a significant improvement in blood pressure, both the first and second numbers. The gut flora also seemed to play a major role, as we know there are positive changes in the gut flora during fasting. So this study found out, and please don't start cheering yet, you can't starve out issues like harmful bacteria or fungi in your gut flora just by fasting. That's often misrepresented. You actually need to take specific actions against these harmful organisms. These connections with the gut flora are indeed being further pursued and thoroughly investigated for better understanding. Interestingly, in traditional Chinese medicine, the small intestine is the partner organ system of the heart. And of course, we know that if biogenic amines are produced there, if histamine is produced, then that can naturally also raise blood pressure. So, very, very intriguing connections. Now, naturally, many people are wondering, yes, this is now a strict fast where I eat nothing for days. Can this also be done with intermittent fasting? Does this also work with the 16.8 fasting method? A major study from 2022, published in the New England Journal of Medicine, sheds light on this. In this study, 139 patients with obesity were rigorously examined. They either had their eating restricted to between 8 a.m. and 4 p.m. with calorie limits, or they simply followed a 16.8 fasting regimen. All participants were then instructed to maintain this calorie-reduced diet for 12 months over the course of a year. Men received about 1,500 to 1,800 calories, while women had slightly less, between 1,200 and 1,500 calories. The study also found that intermittent fasting led to weight loss and improved blood pressure. And here too, we can truly say that there are already many studies proving that intermittent fasting does indeed contribute to weight loss and also helps lower blood pressure. There are also studies showing that it's not superior to other weight loss programs or dietary measures, but at the end of the day, it works. Let's take a look at how such fasting actually proceeds, especially how it should proceed, and also consider some side effects. Speaking from clinical experience here, as there aren't many doctors who actually have clinical fasting experience, I've supervised hundreds of people during fasting in the clinic. It's important that it's conducted calmly, that you take time for it, take a break from your job, and ensure it's all stress-free, like a little wellness retreat for your body. I tried all this myself while working. I made 3 attempts to fast during my medical duties. Each time was my first fast. I had no chance. So, you need to rest, you need the opportunity to sleep, to lie down, to relax, do Qigong, Nordic walking, go outside, take a walk. You also need to allocate more time for eating, even if there's not much to eat. It's essential to handle everything calmly, drink plenty of water, take frequent bathroom breaks, and so on. Typically, this fast lasts 7 to 10 days depending on your preference. Many individuals adjust their fasting duration, realizing its benefits, and may extend it by 3 or 4 days. It's great when the whole thing happens in a group, so you're not alone and can share your struggles. You can read a lot, rest, and maybe even get a massage. And I had a colleague who always did the exact opposite in the same clinic. He was a professional faster, had fasted over 30 times, would fast once a year for over 40 days, and worked completely normally in the clinic, as if nothing had happened. So, these are professional fasters who have done it many times and can integrate it seamlessly into their daily lives. I also have many patients in my practice who have now incorporated this into their daily lives, and we're talking about their 17th fast or something like that. The second fast is naturally easier and can even be done on an outpatient basis, but the first fast, especially if you have high blood pressure, should really be done in a clinic or a sanatorium. So, what are the side effects of such fasting? First, you can get tired, you can get weak, you might get headaches, especially people with migraines benefit greatly from fasting, and a severe migraine attack is practically inevitable on the first day of fasting. We do check this in the clinic, we ask if you suffer from migraines, and then you'll need a doctor to administer an IV. The whole migraine attack can be so severe that they can't keep a pill down, and that's why it's crucial they get an infusion. We then administer intravenous aspirin, which is no problem at all. So, acetylsalicylic acid, it works very, very well even in patients who don't respond to other headache treatments. Intravenously, it works quite well. Another possible side effect is mild headaches even in people who normally don't suffer from headaches or migraines. It's just related to the toxins being mobilized and also has to do with blood sugar levels. The first 1, 2, 3 days, we need that time to switch to fat metabolism. And after that, you might notice bad breath. This means when you exhale ketone bodies, that is, when fat is being burned, it can cause an unpleasant breath odor. Naturally, you might feel a bit irritable, yes, especially when people have their food taken away, and during this switching phase from glucose to fat metabolism, it's natural to appear somewhat irritable and so on. So it's important to also have opportunities to relax. Please share this video because this information about weight loss for high blood pressure is generally not well known, even though it's mentioned in every professional journal and in recommendations worldwide. Yet many people fail at losing weight and are not aware of this tool of fasting or intermittent fasting in this context with rapid and natural blood pressure reduction. Thanks to my channel members who make these videos possible, and I'll see you in the next video. And remember, think of your friends, your relatives, your loved ones, and share this video. Thanks for watching. See you soon.